Hello and welcome to Western Perspective. This week is a service making sure people across regional WA have access to healthcare and emergency life-saving treatment. WA's Royal Flying Doctor Service have been helping look after regional West Australians for 90 years, but now they're getting extra help with a new jet bolstering their capabilities. I spoke to CEO Rebecca Tompkinson about the part the new jet will play in regional healthcare.
It's a really important capacity addition for us as an organisation. We had our busiest year ever in 2021, doing more than 10,000 patient transfers. As we prepare for COVID-19 and the response the state needs, this additional jet adds extra capacity to our organisation at a time when it's going to be needed most.
So what are the features of this jet that make it an important addition?
Our new jet, the Rio Tinto Lifelight PC-24, can take 3 stretchers instead of our standard 2, which means we can take 3 patients instead of 2. And more importantly, it will enable us to take 2 medical crews instead of our standard 1. And it puts time on our side. Time is a really precious commodity in regional areas, and this jet can halve the time it takes us to travel from Perth to Broome or from Perth to Esperance, putting time on the side of the patient.
With COVID affecting the regions, how important will this jet be in servicing that community?
This jet adds an additional strength to our service. We have brought on new frontline team members, more pilots, more doctors, more nurses, and new assets to ensure that we are able to increase our service capability and meet the demands of our services as they're needed.
With the need for doctors in the community, in the regional community in particular, how important will this be?
So our service works in partnership with Aboriginal Medical Services, with WA Country Health and with the broader health system. So being able to ensure that we've got that extra capacity means that we can add to all of our partnerships and all of the community organisations that we work with to ensure that we can meet the service needs of the patients in regional areas.
And how vital will that be?
That'll be incredibly important to all of our organisations. We're very proud to have partnered with Regional Western Australia for more than 90 years. Regional West Australians have always stood by us, and we will continue to ensure that we deliver the best possible service we can for them each and every day.
And now, here's AMA WA spokesman Dr. Andrew Miller with his weekly COVID-19 update and commentary.
Hi, well, it's been an odd week in Western Australia as we reach thousands of cases per day at the same time as the rest of the country is dropping all of their remaining COVID restrictions, it seems, which is a bit out of whack with the idea that case numbers are on the rise around the world, and the effect of the booster vaccines overseas is shown to be waning, so that unfortunately we're also seeing things like hospitalisations and deaths on the rise in places like the UK and Denmark. The West Australian situation, I think, is very positive because we have such fresh and high levels of third dose vaccination. The Premier is exactly right about that. And that's standing us in very good stead, except, of course, in the school age groups, where we're seeing in the young ones who are not wearing masks, very high spread through those classes, and I'm sure you're all aware of people, if it hasn't affected you directly, who have the illness in their family. So our thoughts are with them, and we hope that this will be a fairly low peak, but know that we need to keep doing simple measures as time goes by. So can't do enough to encourage people to use good quality masks, N95, P2 masks, KF94 masks, the ones that seal well around your face, really do make a huge difference, especially if both people are wearing them when we're indoors in particular, because fresh air is the cure for this virus in terms of diluting it, getting rid of it, blowing it away like cigarette smoke. So I hope that we continue to see a fairly flat peak here over the next week, and as we're reaching that time that I think will be at about the top of the number of cases in Western Australia. And if we do get through with what is being predicted as relatively low cases, hospitalisations and deaths, then it will be a remarkable achievement, and one that Western Australians should be very, very proud of. I think that we're quite good at complying with the simple and relatively painless way of using masks. And remember that the Centre for Diseases Control advises that if you're in a situation where you don't have a huge supply of the high quality masks, it's not unreasonable to revert to using 5 masks one day each and then rotate the masks as time goes by. It's obviously ideal to use a brand new mask every day, but for people who can't afford it, then if you have an unsoiled mask that's been undamaged, you don't wash them because that will damage them, but you can set them aside and use them again in 5 days' time quite safely. So check the American CDC website for details on that. Thanks again.
And that's WP for this week. We'll be back again next time, but for now, it's back to you, Ivan and Melly.
Thanks, Nelson. And here is Leo with what's coming up on 6 News tonight.
Thanks, guys. Today on 6 News, authorities warn that COVID cases in New South Wales could double within 6 weeks due to the Omicron BA2 subvariant. Plus, YouTube blocks access globally to channels associated with Russian state-funded media, including RT. And MP Dave Sharma denies mimicking an independent rival's colour scheme. You can see full details on those stories and plenty more by heading to our YouTube channel. Just search 6 News Australia to find us, or our website, 6newsau.com. For now, though, guys, it's back to you.
Thanks, Leo. And that's our weekly news and current affairs. We have the latest news on our website, wmnnews.com.au.
From Melly and myself, wish you good health, good night. See you next Sunday.
Thanks for watching.